this compilation video, I'm going to share with you the top 6 FAQ of Narcissistic Personality Disorder, as well as the official DSM-5 diagnosis criteria. So let's get started. My name is Angie Atkinson, and on this channel I offer free daily video coaching to help you discover, understand, and overcome narcissistic abuse in toxic relationships. I like to call it toxic relationship rehab. So if that sounds good to you, hit that subscribe button and we'll just get going. Let's just jump right into it. What is narcissistic personality disorder? At its most basic level, a disorder where people have a really inflated sense of self-importance. The cause is officially unknown, but we'll get to that. And most researchers, doctors, scientists say that it probably involves a combination of nature and nurture, or environmental factors and genetic factors. The disorder does need to be diagnosed by a professional. Most of the time, people with narcissistic personality disorder won't be diagnosed unless they happen to be forced into therapy for legal reasons or by a spouse or loved one who threatens to go away if they don't do the therapy. Number 2, what causes narcissistic personality disorder? Well, as I said, it's caused by a variety of factors. Scientists are unable to put their finger exactly on the one single thing that causes it. They talk about it being caused by things like environment, as in if you grew up in a toxic family, you may have toxic behavior. Number 2, genetics. They have, in some cases, done studies on people who were known to be narcissistic and found that part of their brain that controls empathy is thinner than other people. And number 3, neurobiology, which is basically the connection between the brain and your behavior or thinking. All of these things are connected. So, bottom line, it's a complex reason. In my opinion, very often it comes from some sort of trauma that happens in childhood where the person wasn't properly taught to deal with the issue, and I think that's where a lot of people grow confused in that situation. It's very complex. Number 3, what are the signs or symptoms of narcissistic personality disorder? Well, we have a sense of grandiosity, exaggerated sense of self-importance, a big old sense of entitlement, and the need for excessive admiration, expecting to be recognized as superior by the people around them, exaggerating their talents and their achievements, being preoccupied with weird fantasies about power and attractiveness and brilliance and money and things like this. Not only expecting to be noticed as superior, but believing they're superior to other people around them in all kinds of ways, physically, intellectually, and otherwise. Believing they can only associate with special people who are on their level, monopolizing conversations and looking down on people who they consider below them, belittling people, expecting special favors. This all goes back to the sense of entitlement, expecting things to be just different for them, expecting to get different privileges than other people, taking advantage of other people to get what they want, inability to recognize the needs of others as in they have no empathy, being envious of others, expecting others to envy them, being arrogant, expecting the best of everything all the time. They might become impatient or angry when they don't get special treatment. They have significant interpersonal relationship problems, and they feel slighted very easily if they don't get the same thing you got or more things than you got. They react with rage or contempt if you try to call yourself equal to them. They may also react with what we call narcissistic injury, where they go, oh, poor me, if you don't do what they want. They have a really hard time regulating their own emotions and behavior. They feel depressed, they feel sad, they feel moody because they often fall short of perfection because they're human like the rest of us, contrary to what they'd like you to believe. They have secret feelings of insecurity or humiliation or shame or fear. And what it all comes down to, if we're being really, really honest, the one quality that unites all narcissists of the toxic nature is a lack of empathy. They don't care how you feel, and you know it by the way that they treat you. So there's your answer to our next most frequently asked question about narcissistic personality disorder. Do narcissists have empathy? And the answer is no, not unless it's convenient for them. Sometimes they may appear to have empathy, especially during the beginning of a relationship or when it suits them to do so. But in general, no, narcissists will not show or give or even have, in many cases, empathy. So they don't care how you feel. Number 5, is it possible to change a narcissist? Is it possible? Maybe. But the narcissist would have to want to change, and chances are that's not going to happen. I've never seen it happen, and from all of the other professionals in this niche and psychologists, psychiatrists I've spoken with, no one else has actually said to me that they've seen it happen. One doctor on YouTube here says that he has healed narcissists. His name's Dr. David Hawkins, but I've spoken to his clients' wives before. He treats male narcissists, And I've not heard anything about actual change. I've heard behavior modifications. I've heard that they will need to remain in therapy for their lifetime in order to continue these behavior modifications, and that the narcissists still sometimes slip up and roll back into their old behavior, even with the therapy. So my answer is, yeah, they could change if they were to go in and heal their core wound and figure out what that is and really work through it and do the psychological work. But will they change? I don't think so. I've never seen it happen. Number 6, is narcissism a mental illness? No, it is considered a personality disorder in the cluster B family. And here's the official diagnosis criteria. Symptoms of narcissistic personality disorder according to the DSM-5. The NPD diagnosis is made when someone exhibits at least 5 of the following traits. Number 1, a grandiose sense of self-importance. Number 2, a preoccupation with fantasies of unlimited success, power, brilliance, beauty, or ideal love. Number 3, a belief that he or she is special and can only be understood by or should associate with other special or high-status people or institutions. Number 4, a requirement for excessive admiration. Number 5, a sense of entitlement, unreasonable expectations of especially favorable treatment or automatic compliance with his or her expectations. Interpersonally exploiting others, taking advantage of others to achieve their own ends. Number 7, a lack of empathy and an unwillingness to recognize or identify with the feelings and needs of others. Number 8, enviousness of others, along with the belief that others are envious of them. Number 9, a tendency to arrogant, haughty behaviors or attitudes. That's all I've got for you right now. As always, thank you so much for being a part of my day and a part of my life. And hey, thanks for letting me be a part of yours. It really does mean a lot to me. I'll see you soon. It's my mission to teach others what I know to be true. You really can create the life you want. Take care of your body. Take care of your soul. Nurture the real you and introduce him or her to the world. Be comfortable in your own skin and in your place in this world. Take your spot. Take it now. And the universe will take its cue from you. You feel me? If so, subscribe to my channel. Let's get it done together.